Hello everyone, Dr. Eric Berg here. Today we're exploring a simple yet powerful remedy for seniors baking soda water. This common household item, sodium bicarbonate, can support your health in surprising ways as you age. We'll break down 7 health issues that may improve with proper use of baking soda water, from acid reflux to kidney function and more. The science centers on pH balance and your body's natural buffering systems, which can shift as you get older. Remember, this is educational information, not medical advice. Always consult your doctor before trying new remedies, especially if you have health conditions or take medication. Your safety comes first. Let's start with acid reflux, a common and often frustrating issue for many seniors. It's something that can strike after a big meal, late at night, or even just from certain foods that don't agree with you. Acid reflux happens when stomach acid escapes upward into the esophagus, causing that familiar burning sensation in your chest or throat. This discomfort, often called heartburn, can make eating and sleeping difficult. Many people reach for over-the-counter antacids, but did you know that simple baking soda can work in a similar way? It's a natural, affordable remedy that neutralizes stomach acid just like commercial antacids do. When you mix baking soda with water, it creates a solution that raises the pH in your stomach, making it less acidic. This can provide quick, soothing relief from that burning feeling. Think of it as a chemical fire extinguisher for your stomach, quickly calming the acid that's causing discomfort. But remember, this is only a short-term fix. It doesn't address the underlying reasons why you're experiencing acid reflux in the first place. Use baking soda only for occasional relief, not as a daily habit. Your stomach needs acid to digest food and absorb nutrients, so neutralizing it too often can cause other problems. The usual dose is about half a teaspoon of baking soda dissolved in 4 to 6 ounces of water. Sip it slowly, and don't exceed this amount. Too much can upset your body's natural balance. Relief is often rapid, and some people prefer this simple remedy over commercial antacids, which may contain extra ingredients or artificial flavors. However, it's important to know that baking soda contains a significant amount of sodium. If you have high blood pressure, heart disease, or kidney issues, you need to be especially cautious. Always check with your doctor before using baking soda for heartburn, especially if you're on a sodium-restricted diet or taking medications that could interact with sodium. If you find yourself needing relief often, or if your symptoms are severe, don't ignore it. Frequent acid reflux can be a sign of GERD or other serious conditions that need medical attention. Don't just mask the symptoms. Work with your healthcare provider to find and address the root cause of your discomfort. In summary, baking soda can neutralize excess stomach acid and ease heartburn, but it should be used wisely and only when truly needed. Be mindful of your sodium intake, and always consult your doctor before trying new remedies, especially if you have underlying health conditions. Occasional use for acute relief is fine, but remember, it's not a long-term solution. Relying on it too often can do more harm than good. Understanding the chemistry behind this remedy helps you use it safely. Baking soda is powerful, but it must be respected and used with care. Your health and safety are always the top priority. Don't hesitate to ask your healthcare provider for guidance. If you're ever in doubt or if your symptoms change, seek professional advice right away. Now that you know how baking soda can help with acid reflux, let's move on to the next benefit and see what else this simple ingredient can do for your health. Now let's talk about kidney function, a vital concern as we age. Kidneys filter waste and help maintain your body's acid-base balance, but their function can decline over time. Diets high in animal protein and processed foods can increase your body's acid load, straining the kidneys. Some research suggests that, under medical supervision, baking soda may help neutralize excess acid in people with chronic kidney disease. This can potentially slow kidney damage by reducing the acid burden. However, this is not a home remedy. Dosing and monitoring must be done by a doctor. Too much baking soda can cause serious problems, including high blood pressure and metabolic alkalosis. For most seniors, focus on a balanced diet and consult your doctor if you have kidney concerns. Let's shift to physical performance and fatigue, key for seniors wanting to stay active. During exercise, muscles produce lactic acid, which can cause fatigue. Baking soda, taken before activity, may help buffer this acid, potentially delaying fatigue and improving endurance. This concept, called bicarbonate loading, is more studied in athletes, but could help seniors stay active. However, the doses used for performance are higher and can cause stomach upset or increase sodium intake, both risky for seniors. If you're interested, talk to your doctor or a sports medicine expert first. For most, regular moderate exercise, good nutrition and hydration are the best ways to maintain performance. Baking soda isn't a magic bullet, but it's an interesting option for some. Use with caution and professional guidance. Stay active but prioritize safety. Let's look at another potential benefit. Urinary tract infections, or UTIs, are a common health concern among seniors, especially women. As we age, changes in the immune system and other factors can make older adults more susceptible to these uncomfortable and sometimes serious infections. Many seniors find themselves dealing with recurring UTIs, which can impact quality of life and overall well-being. Some of the bacteria responsible for UTIs thrive in acidic urine, which is the natural state for most people. When urine is more acidic, it can create an environment where these bacteria multiply more easily, increasing the risk of infection. Baking soda or sodium bicarbonate is sometimes suggested as a home remedy because it can make urine more alkaline. By raising the pH of urine, baking soda may create a less hospitable environment for certain bacteria, potentially slowing their growth and giving your body a better chance to fight off infection. However, it's important to remember that baking soda is not a cure for UTIs, nor should it replace antibiotics prescribed by your doctor. Antibiotics are the only proven way to clear a bacterial infection. Still, some people find that using baking soda at the very first sign of symptoms may provide some relief or help prevent the infection from getting worse while waiting for medical care. If you decide to try this approach, use only a small amount, about 1/4 to 1/2 teaspoon of baking soda dissolved in a large glass of water. This can be done once or twice a day, but only for a short period, such as a day or two, until you can see a healthcare provider. Along with this, it's crucial to drink plenty of water throughout the day. Staying well hydrated helps flush bacteria from your urinary tract, which can support your body's natural defenses and may help reduce the severity of symptoms. Keep in mind though that not all bacteria are affected by changes in urine pH. In fact, altering your urine's pH too much can sometimes increase the risk of developing certain types of kidney stones, especially if you're prone to them. If you experience symptoms such as fever, chills, back pain, or blood in your urine, these could be signs of a more serious infection. In these cases, it's essential to seek medical attention right away, rather than relying on home remedies. Remember, baking soda should only be considered a supportive measure, not a primary treatment for UTIs. Always follow your doctor's advice and prescribe medications. Also, be aware that baking soda contains sodium, which can be a concern for people with heart or kidney conditions. Too much sodium can worsen these health issues, so it's important to use caution. The best strategies for urinary health remain simple: stay hydrated, practice good hygiene, and seek prompt medical care when needed. These habits are your strongest defense against UTIs. If you're considering using baking soda, always do so with caution and consult your healthcare provider first to make sure it's safe for you. Now let's explore another area where baking soda may offer some helpful benefits. Gout is a painful form of arthritis caused by uric acid crystals in the joints. Uric acid is more easily excreted when urine is alkaline. Baking soda may help by making urine less acidic, potentially lowering uric acid levels and reducing gout flare-ups. However, this is not a primary treatment. Medications and dietary changes are more effective. High doses of baking soda can increase sodium intake and risk other types of kidney stones. Always work with your doctor to manage gout. Baking soda may play a small role in long-term management, but only under medical supervision. Don't self-treat gout with baking soda. Balance is key, and professional guidance is essential. Now let's talk about oral health. Oral health is crucial, especially for seniors. As we age, our teeth and gums can become more vulnerable to problems like decay, gum disease, and dry mouth. Maintaining a healthy mouth is not just about appearance, it's also important for overall well-being, comfort, and even nutrition. Baking soda can neutralize acids in the mouth, helping protect tooth enamel from decay. This simple household ingredient works by balancing the pH in your mouth, making it less hospitable for harmful bacteria that thrive in acidic environments. It also has mild abrasive properties, gently removing surface stains and disrupting plaque. This can help your teeth look brighter and feel cleaner, especially if you enjoy coffee, tea, or other stain-causing foods and drinks. For those with dry mouth, baking soda rinses can offer extra protection when saliva is low. Saliva naturally helps wash away food particles and neutralize acids, so when it's lacking, a baking soda rinse can be a gentle, effective alternative. It can freshen breath by neutralizing odor-causing compounds, not just masking them. This means your breath stays fresher for longer, which can boost your confidence in social situations. Denture wearers can use a baking soda solution to clean appliances safely. It helps remove stains and odors from dentures without harsh chemicals, keeping them fresh and comfortable to wear. Use baking soda gently. Too much abrasion can harm enamel or gums. Always brush softly and avoid scrubbing, especially if your teeth are sensitive or your gums are delicate. It's best used as a rinse, half a teaspoon in a cup of water, swished for 30 seconds, then spit out. This method is easy to add to your daily routine and can be done after meals or before bed. Don't swallow the rinse, especially if used regularly. Spitting it out ensures you avoid ingesting excess sodium or any loosened debris. Baking soda is a helpful addition, not a replacement for brushing, flossing, and dental visits. Good oral hygiene still relies on regular brushing, flossing, and professional checkups. If you have sensitive teeth or dental work, check with your dentist first. They can recommend the best way to use baking soda safely for your unique needs. Keep your mouth healthy with a balanced routine. Combine baking soda rinses with regular brushing, flossing, and dental visits for the best results. Let's finish with one more digestive benefit. Indigestion, bloating, fullness, or mild stomach upset can be eased by baking soda water. It neutralizes excess stomach acid, providing quick relief for occasional discomfort after a heavy meal. The reaction can also help release trapped gas, reducing bloating. Use a small dose, quarter to half a teaspoon in water, only when needed. Don't use it daily. Overuse can disrupt digestion and increase sodium intake. Persistent or severe indigestion needs medical evaluation. Identify and avoid trigger foods, eat smaller meals, and don't lie down right after eating. Baking soda is a temporary fix, not a long-term solution. Always prioritize lifestyle changes and professional advice. Now let's wrap up. We've covered 7 ways baking soda water might support senior health, from heartburn to oral care. Remember, this is educational. Always consult your doctor before trying new remedies. What works for one person may not be safe for another, especially with sodium concerns. Partner with your healthcare provider for the best results. If you found this helpful, comment, and subscribe for more health tips. Thanks for watching and take care of your health. Stay informed and stay safe.